Kia ora koutou and welcome to HR Chats with me, Radar, where we chat all things HR and HR related. For those of you who are long-time viewers or listeners, you'll also know that if there is anything you are interested in having a chat about, we're more than welcome for you to submit people or ideas. Feel free to suggest to the person that you are submitting that you're submitting them. We don't want that to come as an pleasant surprise for them to think, oh, suddenly I'm chatting to people. But they are more than welcome to have a chat if you think someone has something that me or your fellow HR practitioners may want to hear today. What a great topic, and it seems a fitting one for this time of the year as well. Staffing New Zealand's biggest emergency management response, COVID-19. I am talking to Rachel Walker, who has a long career in human resources change and projects in both the public and the private sector. She works predominantly with the Department of the Prime Minister and Cabinet, but also Fire and Emergency New Zealand, the Ministry of Education, and the Ministry for Primary Industries. She's had leadership roles in projects such as the closure of the Canterbury Earthquake Recovery Authority, establishing the New Zealand Emergency Management Assistance Teams, and most recently, the all-of-government COVID-19 Response. She is currently the Principal Advisor Projects at the National Emergency Management Agency, and she's a former National President and Chair of HRNZ, and was the Project Manager for the implementation of HRNZ Chartered Membership. And with her is Karen Singleton, who is Team Leader of Capability at the National Emergency Management Agency. Having originally joined the agency in 2014, she has worked in learning and development for more than 20 years in the UK, France, and New Zealand across tertiary education, private organisations and government. And last year, congratulations to her, she gained a Master of Education. Welcome to Karen and Rachel.
Thank you.
Rachel, I'm going to start with you. What a heck of a bio that is. You know, it's one of those ones that make me feel that I've really just underachieved and done nothing for my fellow people.
Oh, now don't be like that. No, I mean, I've just been around a little bit, that's all.
Look, you but and you've clearly had quite a lot of roles through all of that. What's the basis of what you're doing right at this point in time? The National Emergency Management Agency. Most people probably haven't heard of it, or they've heard of it peripherally. I guess we don't really want to hear of it, because if we hear of it, there's probably been an emergency.
No, and there's probably normally one face that you would have seen, which is Sarah Stewart-Black, our Director of Civil Defence and Emergency Management. So in the past, there was an organisation called the Ministry of Civil Defence and Emergency Management, and the National Emergency Management Agency replaced that on the 1st of December 2019. So we are a departmental agency of the Department of Prime Minister and the Cabinet. There's only 64 staff within the NEMA, which was formed at that date. And so when we started off in the process we're going to talk about, we're a pretty small agency.
That doesn't seem all that many people to cope with what it is that you do. What do you do? So you do the things that Civil Defence did, or is it a broader kind of remit?
So NEMA's role in the sector is that we have a stewardship function. So that means that we support other agencies rather than necessarily undertake a lot of the activity ourselves. So, for example, during a response, we would support the organisation that has lead responsibility. And in this case, of course, that was Ministry of Health.
Right. So you're not rushing out there ordering more sandbags to a breach in the
no,
dock.
No, that's not
metaphorical or literal.
No.
So Karen, and then we've got NEMA, the National Emergency Management Agency. What's NCMC?
Yeah, so the NCMC is the National Crisis Management Centre. So that's a facility that NEMA manages and maintains in a state of readiness for all of government. So basically, it is the all of government facility for when there is coordination required within the national security system for an event. So it's usually activated when there is kind of a national significant event or an event which needs lots of coordination. So as I say, while we maintain it, it's not actually staffed. So once an event happens, we then need to find staff to manage it, to run that.
Right, so it doesn't have a sort of an office with people standing around drinking tea all day, just sort of waiting.
No, that tends to be us in the first instance.
No, and in NCMC, it doesn't have a catchy little name like NEMA. it's kind of difficult sort of acronym.
It comes off the tongue eventually.
Yeah,
you get used to
it, all the jargon that you get in the public sector.
Oh, look, I could imagine so. And then particularly when it comes to crisis management, there would be the first crisis is understanding the jargon, I imagine, of the various acronyms. So when it came to this year, no shortage of events we've had, the weather events and various other bits and pieces. And of course, COVID. What happened when that came through? At what point did NEMA begin to be involved with that?
So my involvement started at the start of March, which was prior to the alert levels starting to move up. And there had been people within NEMA working in this space prior to that, because, we do start to get indications that something might be on the horizon. So we were involved right through till the NCMC deactivated, which didn't happen until the 30th of June. So most of us were involved through that period. There was also been an ongoing requirement on NEMA to continue to support the now arrangements, which has continued with a small number of staff being involved.
I'm suddenly curious as to what kind of people do you have? Are they people with experience in emergency, or have you got statisticians, or the people who think about what might happen? The sort of the planners, the modelers.
It's a wide range, really. We do have people who are emergency managers through and through. We have the planners, as you might imagine, and the policy experts around this. But you also have people, and I suspect that's myself and Rachel, who were experts, were professionals in our own right, who happen to work in emergency management. So there is, amongst the 64 of us, or more now, but there's a wide range of skills and expertise.
Right. And so once the sort of the COVID response started, what was the sort of the day-to-day, week-to-week scenario that was playing out for you? Your relationship with other agencies, your day-to-day kind of roles?
Wow, it's a hard one to answer, that one. Every day was very different.
Yeah, so, I can imagine.
So I can talk you through what my functions were within there. So for example, I was asked to support the initial activation of the NCMC, because we stood it up in an environment where we don't normally work. So normally we are in, well, basically where we're sitting now, which is the sub-basement of the Beehive. And in this case, because we knew it was probably going to be a longer event and we would want to work really closely with the lead agency, this environment isn't that great for the long term. And so we worked out of the Ministry of Health building. So my initial role was to help that to come about and work in that environment right through to the closure or the deactivation of the NCMC. I also during that time supported Karen and her team, had the lovely task of working to make sure we had all of our supplier contracts in place around things like the Unite Against COVID campaign that we had. And then also I was asked to support the establishment of the new all of government unit within the Department of Prime Minister and the Cabinet. So that's where a lot of the remnants of the leadership work has gone, is into that new unit within DPMC.
Right. Sub-basement doesn't sound aspirational.
No,
for those people who are listening and who are thinking, is a sub-basement, no, is that above a basement or are you below a basement?
Oh, we're below.
We're below ground.
Not a lot of not a lot of natural light or great working conditions.
That'll be none.
Not a lot of light. And we also knew it wasn't going to be large enough for what was required, and including the physical distancing, which we needed to implement as well. So that's another reason to not establish it here.
Yeah. So I'm imagining not only is that space not enough, but you probably had to look around and think, do we have enough people? Do we have the right kind of people? How did you go about looking for more people to fill the kinds of roles that you needed?
Yeah. So that was really kind of what I was doing. So I was staffing manager during the response. So that was everything from recruiting to offboarding. And so you're right, we needed to find staff, but we needed to know what skills did we need. And then did the people actually have the correct attributes to work in such a fast-paced environment? Because it's very different to kind of a BAU office environment. And because everything was moving so quickly as well, we couldn't put job ads out there. There was none of that traditional recruitment process. So the Chief Executive of the Department of Prime Minister and Cabinet and our own Chief Executive of NEMA, they reached out to central agencies and asked those agencies to provide staff. Those agencies responded marvelously. It was fabulous. We had a huge response, and each agency then created a point of contact. So that enabled us to then continue a relationship, to build a relationship with the agency. But then they also did a lot of the work within their agency. So they could go into their agency and say, hey, look, the NCMC is looking for these kind of people for this kind of length. Who's interested? You're stopping your day job. You're going to go along to the NCMC and help these people. So we received these names, we received this information, we collated all of that into this fabulous database. So I had a team helping with this database. We also had to collect information about people's health, which of course was, because it was a pandemic, we couldn't allow anybody into the NCMC with any symptoms or anything. So we had to be kind of very careful on that side of it as well. And helping us on that, we actually had a medical director, so Dr. Chip Grisham from Counties Manukau and DHB. He was giving us great advice and expertise in that to make sure that we could keep everybody working in the NCMC safe. So when we received people's names from agencies, we gave them a call. We said, hey, look, this is kind of what we need. What are your skills? We kind of matched them up. And then we said, hey, great, can you come to induction tomorrow and we'll get you started the day after, kind of thing. So it was really as quick as that.
Crikey. And what a big decision for people, I suppose. You know, you reach out and say, hey, hello, we're from the government and we need you to come in. Tomorrow seems good. What are the kind of pressures that people face with that? I guess they don't know how long things are going to go for. They may be in their role. They may have weeks of meetings and appointments or patients or things planned out. How do you go about sort of bringing people in? I guess the excitement factor.
There is part of that. So you get people who are very keen, kind of in emergency management, but you also get people who are very keen to just help. We all knew something was going on. You know, we could see that happening around the world. We kind of, in New Zealand, we all knew it was coming our way. So to be asked to come and help with that, people were just, I mean, they
loved it. They absolutely loved it.
Yeah. And you also have to remember, as we went into alert level 4, lockdown occurred, people had to readjust in their jobs. So some jobs did kind of, I don't know, stall, or people did kind of question, well, what is happening with my job? So when we were able to say, hey, look, you can come and help us in this, I think people appreciated that kind of change. Yeah,
we had people who just really, really enjoyed the environment. And I mean, first of all, we'd really like to thank all the individuals who came and the agencies for releasing them, because without them, we couldn't have staffed the NCMC. And we mentioned the size of the agency. It's just not physically possible, because we had over 600 people working in 2 sites during that period, the main site being the Ministry of Health, but we had another site as well down on Langton Quay. So, you know, it's a major exercise and we just can't do it. And it was a really good example of a cross-government cooperation. So some of the agencies that contributed people were organisations who you wouldn't think would normally be involved. Organisations like the Education Review Office sent us people, for example. So it was really important to understand the skills the individuals had and how those might be transferable. And we also needed to recognise that some people had people always have things going on in their personal lives. So it's not always simple for people to be freed up. And, you know, it's just something that, you know, we had to be able to be flexible and allow it to work how it worked for them.
I've been at a couple of conferences in the last week or so where a number of people, ministers and various others, said, you know, nobody really understands how much work that public sector did.
No.
You know, when the story of this is told, do you think the ordinary public will be astounded at just how much, you know, was done without them kind of really knowing about it?
But doesn't that mean we did our job well then?
Yes, it does.
So yes, but there was a lot of work and everybody worked really hard. And that was certainly one of the challenges. But I mean, people working public sector, I guess, to support New Zealand and to ensure that people can have the life that we want here. So, yeah.
Yeah. Now, you've mentioned obviously people needed to have their health checked and needed to have their various skills. What were some of the kind of things that may have come up during with the stress, with the speed of it, because this is not like a normal thing you're dealing with, not only the pace, but huge societal change. You're needing to take people on board. People are worried about their families, their relatives overseas. The unusual stresses, how were they handled?
So, I mean, we had a range of things. So, for example, I'll talk through a few things. One of them was, we've got this lovely story of the fabulous Dr. Gresham who came and supported us. And one of the things he did was help us with our physical distancing. So at one point, of course, we had to have 2 meters between all desks and those types of things. And the smell of bleach was strong in the air because we were cleaning desks down morning and night, and we couldn't get other forms of appropriate cleaner at the time. So we were diluting bleach, so there were protocols around that. And we had little stripes on the ground. So there were blue stripes that you could put a chair between and grey crosses that you weren't allowed to sit in. And so there became this real culture of everybody encouraging people to abide by the social distancing. But the really funny part of it was that seemed to spread around those parts of Wellington that were still functioning. So we did have some people, for example, working with us who were from out of town. And so they were being accommodated in a particular hotel. And so that hotel picked it up, as did some other agencies who were still functioning. So there are blue lines and grey crosses that appeared all around Wellington. And, we did start...
To add to the number of acronyms, you then had to learn the colour coding of masking tape.
Yes, it was quite exciting, and learn to enjoy bleach. So, we also started this whole process with a group called the Emergency Management Assistance Team, which is an arrangement that NEMA set up late last year. It first went live in August 2019, and that's made up of people throughout New Zealand from various agencies. They go through quite a rigorous selection process, and we were fortunate in being able to call on some of those people to help us with the initial stand-up and get going. So some of the stresses that people were finding, going through this is things like, obviously we needed to cater single-serve meals. People obviously had personal challenges of their own that they were dealing with going on. And the NCMC is not an environment for everybody. It is high pressure, it is fluid. As you can imagine, the supply and demand for particular skill sets changed as this thing went on. And then, of course, we always knew that it was likely we would start to see some fatalities in New Zealand. So we had to think about how were we going to communicate that internally when that started to happen, as opposed to our people hearing it on the 1 o'clock stand-up, because we all pretty much used to stop for the 1 o'clock stand-ups. And you can imagine when the alert levels went down, there was a big cheer that went round. So, we needed to kind of always think ahead. We also initially were dealing with the travel exemptions process during alert level 4. So we had a team dealing with that. And I can't remember the exact number, but it was somewhere in the vicinity of 13,000 requests that they dealt with in a very short period of time. And it was quite a small team. And some of the stories they were hearing were quite traumatic and very difficult for people to hear. And at times, not unreasonably, I guess, the people they were talking to were very angry and hurt. And so that was a team that we made sure we put some support around in terms of how they dealt with difficult calls and their own well-being, because that was a really, really important thing for us, because as Karen said before, people loved working there. So that's great until people are loving it and working really big hours and not getting many days off and things like that. So we kind of had to enforce days off and well-being and ask our senior people to role model some of that.
Yeah, because this is not a normal, employment contract situation. You probably still have to have it. So was there a fluidity around that contracting? Obviously, there's an indeterminate length of time. There's some people coming into a position that they may never have experienced before, and they may be suited to it or not suited to it. How did you deal with managing all of that?
Yeah. To be honest, it went well because everybody was fluid. The employment contract with people's agencies remained unchanged. They were still employed by their agency, but their agency was loaning them, as it were, to work in the NCMC. But we still had to make sure that those people who were working in the NCMC, that we looked after them appropriately. And as Rachel says, that they did take appropriate rest.
Yeah. Out of curiosity, so who picked up the tab for that? Does that move into you? So you've borrowed them and or they essentially they remain in their previous position on their previous salaries, and you just second them, right?
Yeah, it was kind of an informal secondment. We did get paperwork in place, but still it wasn't the kind of formal secondment paperwork. Partly, I guess, because of the situation. But as I said, I mean, government agencies have been asked to provide staff to help because we knew this was going to be an all of government. This was a whole New Zealand, it was a global thing. So we just knew everybody needed to be involved, and agencies were just, as I say, they were great. They lent us people. Originally, we'd said for 4 weeks because we were, kind of picking a number out the air, and 4 weeks came and went. What we found in the end is about half of the people who did come, they stayed for about 6 weeks or longer. So we did have some people who stayed for a long time, and that was negotiation with the individual, with the agency, with their manager, because obviously there was work back in that home agency that wasn't happening. So they had to kind of manage that. But I mean, they gained new skills. They were working in new environments. Teams were having to form, overnight and perform and work together. And yes, sometimes if people didn't gel, that was okay. There was a conversation and a kind of, hey, I'm not fitting really well into this team because, my skill here isn't being used. We'd have a conversation and slot them in somewhere else. And that worked really well. Again, because everybody's willingness to help, I think. Everyone was just so flexible.
Yeah. So the agencies really leaned in and they continued to pay the salary. They continued to pay the salary for the individuals they provided. So it really was an all of government effort that was led out of the Department of Prime Minister and the Cabinet, particularly through NEMA.
Because it reminds me of some of those war movies that you see, don't you, where someone's working away in some obscure factory in the north, and then someone from the government comes in and says, we believe you could be of help, and they're whisked off. And then I imagine, what an incredible resource you must now have, that big Excel spreadsheet of all of these names. And then I imagine even from that, you've brought someone in from somewhere and they think, you know what, I know somebody and they might know somebody, and suddenly you've got this resource now that you will have for some time, I would imagine. Absolutely.
So we had the database which we created during the event, and afterwards. So asking agencies to provide staff as surge staffing isn't new. So it's something we have done before. So during the Kaikoura earthquake event, for example, we did have staff who joined us in the NCMC from other agencies, but that was in much smaller numbers. In this event, we had, as Rachel said, 600 people over 2 sites. The site we were particularly focused on at the Ministry of Health, we had about 300 people. We've got people there, as you say, who have kind of discovered that emergency management might be a career for them. So they're really interested in that. But from our side, as I said earlier, because we have to maintain the NCMC in a state of readiness, having skilled staff who can work in one is a great plus. And now we have this database of people who have worked in one. And part of the offboarding, and we can talk about that if you like,
was about to be my next question. Yeah. How did you let them go, or know when to let them go?
Yeah. So, part of that process was actually kind of just checking in with them and saying, hey, did you like this? Do you want to stay on our list? So that if there is a big event, a significant event again, we will call you in. So we kind of managed it like that. And we also have a similar list for Auckland. So we have what's called the alternative NCMC in Auckland. So if ever we can't function in Wellington, we have a similar database and a similar pool of skilled staff in Auckland. So my team are currently up there as we're recording, training some staff. And that's the idea, that we will keep on developing these people, keeping engaged with these people so we can maintain that, But to go to offboarding, that was a process which we wanted to do very carefully because, you know, going back to the agencies have been very generous, people have been very generous. We wanted to make sure that we thanked people appropriately, but also that we valued what they were telling us. So there was an opportunity for them to debrief, so individual debrief and a group debrief. So that's allowed us to capture any improvements or any things which were working really well. So we could continue at the time and we can use in future events. So that was really good. Then everybody received an individual thank you letter. Agencies received thank you letters. And we also collected feedback from the people, particularly their manager they were working with. So we could provide people with some comments around their contribution. Sorry. Yeah, so they could have this kind of summary of their deployment, of what they did while they were with us, and what feedback they were given, so that when they go back to their home agency, they can say to their manager, hey, I was here for 2 months, this is what I did, this is what people thought of my contribution, and this is maybe how it impacts on my development now. I want to move into more of a leadership role because I was allowed to kind of be in a leadership role here, or I was enabled to do some kind of planning here, which I've never really had the time to do in my job before. So we hope that this has been really useful. And another thing that we did as people left, around, again, as I say, thanking them, is we had a daily stand-up. And during that daily stand-up, we had a karakia. And then following that, we would thank people who were leaving that day. So there would kind of be an in and out process. We would ask people who were just coming in to introduce themselves. And those who were going out would be thanked, usually by their manager or somebody within the team who'd be working with them.
Yeah, we also, we had a lot of celebrations while we were in there. So, excuse me, we were fortunate enough to have NZDF, the New Zealand Defence Force, amongst the people in there. And so, for example, on Anzac Day, they did a ceremony for us. There is a common currency within NEMA, referred to as cake. So we would see a fair bit of that kind of thing as well. And, you know, bearing in mind that we had to be careful about how you deal with food in that kind of alert level environment. But yeah, we really did try to make this an environment that people enjoyed and felt they got something from. Bearing in mind, many of them would say things like how much they enjoyed feeling like they were really contributing to not only something that was quite a historic time, but really supporting New Zealanders and New Zealand communities, because that is what NEMA and the emergency management system is actually all about.
Yeah. Ongoing sort of monitoring of people's, I guess, welfare, because some people would have had some pretty traumatic sort of things to deal with. I think, you know, particularly the people who were, you know, having to deal with people trying to come back and they couldn't come back and various other bits and pieces. You sort of continue that monitoring or reaching out? Again, as part of the offboarding, we provided them with details as to where they could get help, because we are not the professionals, there are professionals there, so they have got access to EAP. But what we also did was, it was about 2 weeks after people left, we would just give them a ring and we would just check in with them, because not only, as you say, had they gone through this, they had been working in an office environment when the rest of New Zealand had already moved to remote working. So they had to go through that adjustment that their colleagues had already done, you know, like a month or 2 months previously. So we gave them a call a couple of weeks after, just sort of say, you know, how are things going? Anything else you want to feed back to us? And just a little reminder to reach out, to talk to friends, to talk to their managers, to go through their normal chains of support. And kind of letting them know it's okay, because that difference between working in the NCMC and going back to your day job, that can be a bit of a change, even for us.
We had a number of people sort of comment on the going back to the normal job and it being quite deflating. So, you know, you've been in this quite hyper, high energy, high paced environment, and then you kind of go back and it's kind of a bit, ugh. And so a number of people commented on that. So again, the wonderful Dr. Gresham put together some material for us about that we circulated around people about how this was quite a normal experience.
Yeah. Because, you know, going back to your ordinary day job, you go, oh, well, this is boring, you know. So there must have been, as stressful as it was, as tense as those moments may have been, as emotionally harrowing at times, there must have been some pretty amazing outcomes.
Yeah. And I mean, I think Karen and I have the same experience of not really experiencing what it's like to live a level 4 lockdown in the same way that many people did, because, you know, we were going to work every day and Wellington was very quiet on that walk through on a daily basis. So yeah, really incredible experience. I know on a personal level, it was actually the first time I'd worked within the NCMC, and incredibly rewarding. You get to do a variety of things that you'd kind of never thought you would, and work with some pretty amazing people. There were some very, very high profile and high powered people, particularly from around the public sector, who were involved with this. You know, we had opportunities, we were regularly connecting with the leaders of this response, people like John Ombler and Sarah Stewart-Black, of course, who's our director, who we work with frequently. But you know, it was a pretty incredible experience to be able to say that you've been a part of, and very humbling on one level, and also just so rewarding to be able to kind of give back and do that for New Zealand and its communities. And it kind of, to an extent, didn't matter what your role was in there, because you were contributing to that, and it was just such a rewarding experience.
Yeah, I contributed by just staying at home. Karen, how about you? Yeah.
No, and that's what we wanted people to do, so that was really great.
Great.
No, it was. I mean, I've been in a number of NCMC responses. In fact, I can't remember how many, which is, it's worrying. And this one was obviously very different for the scale, but it was also very like the others, because you have a talented bunch of people who are working incredibly hard because they want to help New Zealand and whatever New Zealand is going through. So whether it's been, you know, a flooding event in the past or whatever event we may have faced. So that environment was still the same, just bigger. And I mean, I felt especially privileged and proud to be part of it. I'm an adopted Kiwi, as you can tell from my accent. So to be at the heart of what was going on and to really use my skills to help. And when you're seeing that this is happening across the world as well, and we were contributing to you know, helping New Zealand be safer. Yeah, that's just an incredible experience. Yeah.
Pretty phenomenal. Well, I can tell you what, if you've got a space on your Excel spreadsheet for jovial water cooler conversationalist, no other discernible skills, but I'm happy to stand around and chat to people during the course of the day. Hey, look, just on behalf of everybody, as I say, you know, so much work was done by so many people that I think most New Zealanders will, in many ways, never be aware of, because that's the nature of the kind of work it is. So thank you to both of you, to Karen Singleton and Rachel Walker. Anything you wanted to add before we disappear?
Look, again, I know we've mentioned it before, but just an enormous thank you, not only to the individuals, but to the agencies who enabled them to come and work with us. And we really hope that they themselves have benefited from the experience. And a thank you to the team of 5 Million for doing such a great job. Because that's really where the success has come from of this exercise. We would hate to still be operating, and you know, now we don't need to, because the NCMC has been deactivated, and that is through the work of the 5 Million team of New Zealanders. So thank you to everybody for what they did.
Yeah, and no joke, if people do want to get onto the spreadsheet, do contact us.
I'm prepared to receive an email. I have no discernible skills, but often, you know, I've watched those movies. It's often the person who doesn't appear to have any social skills or skills at all that can come and solve a problem. So I'll flick you an email. Karen Singleton and Rachel Walker, thank you so very much. This has been just a fabulous episode of HR Chats with me, to radar an insight into the workings of government and the emergency agencies through the course of this. So if you think you have the skills, by all means, get in touch with them. And likewise, if you think there is someone we may want to chat to, have a look on the website. You can see a method to email us there at HRNZ to let us know a topic or a person we can talk to on HR Chats with me, to radar. For now, goodbye.